Yeah, I could point to with examples of specifics. Over the last 2 weeks, I've been involved in investigating two cases of heart attack that were delayed. Both patients had symptoms for days, if not over a week, of chest pain and shortness of breath. They were delayed by the patient's fear of coming in, and probably wishful thinking that things would get better. Another patient had a significant fall and had an ankle fracture that they, again, waited on because they were fearful of coming in. And eventually, a persistent spouse kind of drugged them to the orthopedic department, and where they ended up having to have this operated on.
We had, people thinking that they would be able to tough it out at home and came in with perforated appendicitis, which is a larger procedure and involves more time and risk, which could have been prevented if they could have come in sooner. And we had patients that were to come in for their colonoscopies, more diagnostic, and because of the fear of COVID, they've delayed their the camera test for about 8 weeks. And when we were finally able to convince them to come in, we're able to detect early stages of cancer. These all could have been rolled forward and faster for treatment. So kind of those are two specific examples in the last couple of weeks.
For Dr. Freed and Dr. Shea, in smaller hospitals or ex-urban regional hospitals, do you feel like your facilities are able to cope with any new intake of COVID patients, given that you're asking patients not to delay care and the counties are asking for more freedom to let people gather and conduct commerce?
Definitely the hospital's restrictions are same, and our policies and procedures are still in place. Over the past weekend, we've seen fishing open up, and we do have influx of visitors that are on Banks Lake and Lake Roosevelt. So we're anticipating maybe a small surge. And I think, just speaking for Cooley Medical Center, preparation is the key. I think our incident command discusses about potential surges and COVID patients on a daily basis to see what we need to amp up on and how we need to prepare. We also have weekly community meetings with our community leaders to talk about what their need is, what do they anticipate, and how do we help them prepare for that. So we don't know what the answer is. We don't know what it would actually look like, but I think transparency and communication is the key for this.
I anticipate a surge. I absolutely do. I don't want to be pessimistic, but we have a fair amount of capacity in our ICU, but it will fill up like a narrow-necked bottle when this community opens back up, is my fear. Our limitations are what they are. So I worry about that. I think we have to look at the numbers. We have to collaborate with our county health department and local government and the local business leaders and use our best judgment going forward.